We want to take a quick look at the geographical breakdown of some of Victoria's biggest COVID outbreaks. The number of positive tests linked to key clusters in metropolitan Melbourne have risen, including at Epping Gardens Aged Care and St Basil's in Fawkner. JBS Meatworks in Brooklyn has links to 133 infections, and outbreaks across regional Victoria are causing increasing concern.
Active cases in Bendigo have more than doubled in the past week, from 26 to 57, with 18 cases linked to a chicken farm in Lockwood. Geelong too has seen a jump in infections, with 62 new cases in the past 7 days. 44 are linked to another poultry farm in Breakwater, while there's also been an outbreak at an aged care facility in Heartening. Other regions affected at this stage include Latrobe Valley, Ballarat and Colac, where there are 83 active cases.
Let's dive into the situation further and bring in Norman Swan. He, of course, presents RN's Health Report and also the ABC's Coronacast. Norman, very good morning to you. I wanted to start with the situation in Victoria. The numbers have been falling for a few days, far from a trend yet, but what do you read from those?
Look, I think that the numbers overall have turned the corner. I think that we thought that it was hard. I mean, I made a bold prediction on Coronacast last week that we would turn the corner Monday, Tuesday of this week, and that was based on the fact that Melburnians and people in Mitchell Shire were wearing masks before they were mandated, and then when they were mandated, they were out with masks. That's going to have made a big difference, and hard to quantify, and that people are already changing their behaviour before stage 4. So I think that what you're seeing now is really good and hopeful. The problem is going to be regional Victoria, and with those numbers that Lisa just quoted, I think that you really need to consider stage 4 in regional and rural Victoria, hard though that message is, because I think that unless you go to really strict lockdown and really force people to stop mixing, you're actually going to see those outbreaks in regional Victoria. And you might see the paradox where you've got almost elimination or zero spread in Greater Melbourne and Mitchell Shire, and it's going nuts in regional Victoria, and that's not going to be a good situation. So the trigger for a stage 4, we should learn the lessons, should be early, and that needs to be under consideration because those numbers will get bigger.
That would be a big leap in Victoria, certainly for the mental health as well of regional Victoria, who were sort of feeling this was a Melbourne problem and they were having to pay for it anyway.
Well, you and I, Lisa, have said this several times over the months that in a sense, they were lucky in rural areas in Australia that they haven't had much, if any, COVID-19, but this just shows you that it can spread there. The United States has shown that largely rural states are getting a lot of COVID-19. Nobody is immune.
So is zero spread a realistic possibility looking ahead to certainly Melbourne and if regional Victoria goes to stage 4 too?
Well, put aside regional Victoria for the moment. I mean, obviously that's a difficult policy decision. Yeah. The answer is yes, because although it's coming off the top and it looks fairly slow at the moment, it can go down precipitously quickly, the same way as it can go up precipitously quickly, because the problem in Victoria, as we said last week, is these large numbers of people where you don't know where they caught the infection from, and therefore there are people out there spreading. Well, if you stop them spreading by isolating them, keeping them at home and stopping mixing, then the virus will disappear from their bodies and the numbers of infections could go down incredibly quickly. So a week or two from now, we could be down at quite low numbers, and by 6 weeks, it's possible. I mean, it is possible.
Hey, Norman, we were just chatting to Jennifer then from the College of Nursing and talking about what we can do to try and reduce the risk of infection. What's your take on it? Is it just PPE? And I understand there's some Australian technology that's being used in Singapore.
Yeah, I woke up this morning, not sleeping, I was looking through my emails, and I got this email from a leading academic in Melbourne who said, I've just been looking at doing a search on this, and he came up with this paper, and the paper's in a surgical journal. It dates back to May. They had 0 healthcare worker infections at Sengkang Hospital, 1,400-bed hospital, seen 750 patients with COVID-19, 0 healthcare worker spread, and they had, prior to this, bought 700 of an Australian respirator, which has a HEPA filter, a viral filter at the back and fits around the face. I'm not doing an ad for it, but they claim that that is a key technology that has prevented healthcare workers catching COVID-19 in high-risk environments. And, and they're equating it to full hazmat dress. Interesting waking up to a paper from Singapore claiming an Australian technology for healthcare worker for no healthcare worker spread. I'm not quite sure how much spread there's been since then, but I can't find any indication of that. So look, I think PPE is really important, proper training to wear it, and I think that we have been too confusing for healthcare workers on the case definitions of COVID-19, and I think that low-risk environments are not necessarily low-risk environments, and we've got to be careful. And this issue of closely fitting N95 masks is really important. You might as well just wear an ordinary surgical one if you haven't got a properly fitted N95.
Okay, and just before we go, a lot of people are wrongly seeing coronavirus as the same as the flu in seasonal terms. The argument is, well, it's winter, of course, we're going to cop it worse here in Australia than elsewhere. But the World Health Organisation doesn't agree with that necessarily.
No, Mike Kelly, I think he just said yesterday that there's no seasonal effect. I mean, the pandemic is so large and overwhelming, it is actually overwhelming any seasonal effect. It's likely there is a small one, but we're not seeing that. And you can't blame winter for what you're seeing in Victoria. You're not getting it in other states. New South Wales is reasonably under control. So this is bigger than a seasonal effect. But a year from now, you might see a waxing and waning according to summer and winter, but not now.
All right. Dr. Norman Swan, as always, thanks very much.
Pleasure, Lisa.